Good evening. This is Derek Maxon, Chairman of the Lakeville Board of Health. I'm calling the Lakeville Board of Health meeting to order. It is Wednesday, November 18th, 2020, 6 p.m. In accordance with Governor's order suspending certain provisions of open meeting law relating to the 2020 novel coronavirus outbreak emergency, the November 18th, 2020 meeting at 6 p.m. of the Board of Health shall be physically closed to the public to avoid group congregation. However, to view this meeting in progress, please go to www.facebook.com/LakeCAM. You do not need a Facebook account to view this meeting. This meeting will be recorded and available to be viewed at a later date at LakeCAM TV. Permit me to confirm that all members, staff, and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond affirmative or yes. Bob Palucci?
Present.
Chris Spratt?
Present.
Edward Cullen?
Present.
Okay, and then on the agenda tonight, we have two different engineers. Foresight Engineering?
Present.
Okay, that would be Darren, I believe.
Yes, sir.
And we have Zenith Consulting Engineers.
Present, Jamie Bissonette.
Okay. And then I believe we might have one homeowner on the line with us. Is that correct, Cheryl?
Yes,
Okay, just confirming you can hear me. Thank you. Okay, first on the agenda, 32 Fuller Shores Road, meet with Foresight Engineering to discuss requested local upgrade approval. Darren from Foresight, I'll turn it over to you.
Yeah, good evening. Darren Michaelis here on behalf of the property owners, the Fullers. This is a summer residence that they use for their family. It's been family owned for years. Obviously, Fuller Shore Road was their family road. They owned a lot of property down there. What we're proposing to do is they're currently upgrading the house inside. They'd like to replace the two cesspools. However, they don't use the house full time, so they'd rather not pay the expense of a treatment system at this time and install a leach field, which would remove all the trees on the front of the property. So what we're asking to do is to install the two tanks, the two compartment tank installed backwards, ready for a fast 0.5 in the future, and then the pump tank in series ready, and that will have the alarm in it presently for the tight tank system. So it is going to remain just a seasonal home for the family. If they decide that the pumping gets too expensive, they would come back before everybody with a proposed leach field, which would more than likely require the treatment system because it will be just within that 100-foot buffer. And we also have a couple wells around us that would trigger that. I think the 3 wells would trigger a D-night system anyways. I'm happy to take any questions.
Okay, Darren, thank you. Okay, yeah, that was getting back to my first question was the elevations. Yeah, and the tank were backwards, and I couldn't figure out if that was a typo or not.
Yeah, it was
because you want to use that as a fast tank, correct?
Correct. And it's only going to be a tight tank, so it won't back anything up into the house or anything.
Well, the outlet is 2.5 tenths higher than the inlet. So
It is, yes. It'll back up into the tank
like
slightly, but
2.5
it's a tight tank system, so it's just going to get pushed through. There's no filter. There's nothing to hold it up from just continuing into the second tank. And it's not a high usage. There's really no other way to set it up this way unless I chisel a hole and re-chisel later. And we need the watertight sleeve, so I can't move the inverts. And we're still a 1/2 foot higher than the house, so it won't back up to the house at all.
Is this currently deeded?
It's going to need a deed restriction as a 2-bedroom for sure.
Is
Yes.
this currently deeded seasonal?
It is not deeded seasonal. They do have a well and a system, so I don't believe there's any
Seasonal or
restriction.
not?
Yeah, I don't believe it was. I haven't seen any paperwork saying that.
Okay. I see popping up on my screen. I don't know if you guys are having trouble hearing me. If we're having trouble, I'll have to call on my cell phone, but just let me know. Next question, Dan, I guess what to go back to is the bedroom count.
Yep, we did a walkthrough.
The assessors has it as a one bedroom.
Yep,
I
the upstairs was unfinished. There's
On-
definitely 2 bedrooms in the house.
It says one bedroom. Yeah,
There's one downstairs
ahead,
and one
Darren.
upstairs. Yeah, there's one bedroom upstairs and one downstairs. We did a walkthrough at the time of the perk test. They're very tiny
okay.
rooms.
Just the upstairs was put on recently.
Yeah.
The house was originally a 1 bedroom, and then they
Okay.
put a second floor on within the last
Now, is this
4 or 5 months.
bedroom that was upstairs? Yep.
I couldn't quite catch it, Derek. The upstairs was not there, so I believe it was a 1
Okay, that
bedroom.
was
They
my
went in and,
question.
yeah.
I believe that was just added. They raised the roof.
yep, they went to, they had to go for a special permit.
Okay, so I guess that's where my sticking. Yeah.
I mean,
because
you can deed restrict
we're
it to a
definitely
1
in
if
a
you,
Zone A on the pond, and if it was an existing 1 bedroom, because kind of we've run into before. I know the smallest system you can do.
yeah, I don't know why you would restrict
Okay.
it to a 1. When there's definitely 2 rooms in there.
Would they be okay going to a 1 bedroom deed restriction, or is that?
I mean, I guess if that's what you're gonna tell me I have to do, what choice do they have?
Are you gonna?
I mean, this is a tight tank system right now, so
No,
if
I'm
we,
just trying to clarify if it was a 1 bedroom, it just said it's a.
yeah, so that if
500.
we come back later with a D-night system, we could gain the second bedroom.
That's where I'm going with it, Darren. I mean,
Okay,
if
yeah,
you
so
want-
that's kind of what we're planning for. So I have no problem if you want to de-restrict it now to a 1. And then if they come in for the system, we could remove that restriction and just put in a 2 bedroom. That would be more than reasonable, I believe.
Well, actually, on that argument, I was thinking the other way around. I was
Okay.
thinking if you were looking to go to a 2 bedroom and we are granted just the tight tank,
Yep,
I think I would be in favor of that. Because it's just
Okay.
tight tank. It's the best thing you can have, in my opinion, on the pond.
Yep. and then they will have to, yeah, and they'll have to come back. Yep, and they'll have to
But,
come back to you
You know,
for the
if you
new
wanna-
system.
If you go in the future for E-night.
Yep.
I don't. Right,
Yeah, that would be the board's decision at the time. I understand that.
because it was previously 1 bedroom.
Yep.
I mean, that's how I'm feeling on it. That was my only comment.
Okay.
I'll turn it over to Bob Lucci for your comments on this one, what you're thinking.
All right, Derek, I missed a lot of what you said in and
Oh,
out,
you
but I think the gist of it is 1 bedroom now, and if it
All
comes
right,
back
thank
with a
you. Bob
D-night system.
Lucci?
Hello?
Comments?
Can you hear me?
Yeah,
I
we
can hear you, Bob.
Bob.
I think it's
Okay.
just Derek's cutting in and out.
Okay, yeah, so
I think what Derek was saying, Bob, is he has no problem going to a 2 bedroom with the deed restriction and a tight tank. And then we would have to come back anyways for the D-night system, and that would be the board's decision at that time to hold the 2 bedroom or to not give them the variance for the system. I think that's what Derek was saying, instead of going back and forth.
I don't think that's what he was saying.
Okay.
I think what he was saying is the house was originally a 1 bedroom.
Yep,
He illegally added a second bedroom prior to coming to the Board of Health.
Yep.
So to call it a 2 bedroom now because he illegally added it, you know, I don't know how that works. So you can't say it's existing 2 bedroom now because
okay,
the second bedroom was an illegally added bedroom, and he's only got approval pending the Board of Health. So
Yep.
I think he wanted a 1 bedroom deed restriction.
and then come back later for the D-night and maybe change it to a 2. That's not a
Right.
problem. I don't think that'll be an issue with my client, and I don't have a problem with that.
Yeah, that's what I was thinking. I thought that's what
Okay.
everybody was talking about because,
Okay,
Yeah,
so we'll
'cause
do
with
a
a
1
tight
bedroom and
tank,
come
it-
back. Yep.
With a tight tank, it doesn't matter. And then you're setting it all up now, which is the smart thing to do, knowing eventually
Yep.
you'll probably add that. So I mean, you're saving the guys some money, and then if they start using it more, and
Yeah.
yeah, I'd be
They'll-
fine
they'll
with
come
that.
back.
Just
Okay.
calling it a 1 now and come back with a D night and we can make it a 2.
You got it. I'll make sure I revise the plans to show a 1 for you guys.
Chris?
Yeah, I think we lost Derek. Oh, now he just popped back in, I think.
He's somewhere in
Well,
Lakeville.
Yeah, I was thinking the same line as Bob. There was one thing when
Okay.
Derek was breaking up, he said something about 2-bedroom too, but I'm not sure. Maybe as he comes back in, we can get more clarification. But that was the only issue I had too, was the bedroom stuff. So, and I think so far we've cleared that up. So if we want to kick
Yep.
it to Derek so he can clarify what he was saying.
Perfect.
Eric, are you there?
Thank you. Yeah, I'm here. Can you hear me now?
Yep.
Okay. Yeah, that's all I was saying to clarify. No, just because it was a 1 bedroom existing, I'm fine going with 2 bedrooms deed restriction, but I mean, I would really like to make a note that this is a 1 bedroom. It was previously a 1 bedroom house in the zone A.
Yeah.
Yeah, I think what everyone else is saying, Derek, and I am in
Yeah.
agreement, is I have no problem with a 1 bedroom deed restriction right now. And when they want to come back for the D night, you guys can remove that restriction and give them the 2nd bedroom at that time, if that's suitable with the board.
Yeah, that's what I'm thinking.
I agree with that.
And we keep losing Derek.
Oh, okay. Yeah, you keep losing me. Yeah, I'm fine, as long as we leave it a 1 bedroom now. I mean, if you have plans in the future to going to a system, and if that's
Yep.
okay with everybody, I'm fine with it.
Okay.
Okay. Any other comments on anybody on Facebook? I hear no one on Facebook. Bob, can you
Nothing
hear
on
me?
Facebook.
Okay, thank you. Someone like to make a motion on this one?
Yeah, I'll make a motion that we approve the plan with a 1 bedroom deed restriction now. With the understanding that if they come back at the future with a D night, then we can consider the, going to a 2 bedroom for it.
I'll second that.
Okay, any discussion? I have one comment on that. Just to clarify, note number 9 on the plan, I'd like to have that
Yeah.
changed. It does
I'll
say-
just remove it, Derek. Yeah, I'll remove it completely. It's actually from another plan.
Okay, change that. to
I'll
a
just
2.
remove note 9. Yep.
We had a second. All those in favor, Bob Plucci,
Aye.
Chris Spratt,
Aye.
Derek Maxim, aye. Okay, thank you for that.
Thank you, guys.
Okay, next on the agenda, 13 Summit Street, meet with Foresight Engineering to discuss a variance request after the fact. I'll turn it back over to you, Darren.
How we doing tonight? So this is another project of mine. You guys approved last November. I had a tank being replaced. Unfortunately, for some reason, the installer texted me in March and said the tank was a 1500, and I mistakenly said we can probably leave it. And then, of course, he pulled the permit a couple weeks ago and saw that the tank had to be replaced. And he didn't do anything about it until he was ready to put it in. And then Ed told him the tank had to be replaced, and he called me very angrily. So in the end, what happened is he gave a bid without the tank being replaced. The homeowner took a loan out, not including a tank replacement. Now the leach field is installed, backfilled, and as-built it, as you see on the plan in front of you. And it's all working to date. The tank is a 1500 gallon. It does have a filter installed, does have a riser to grade, so it meets all state requirements. I understand the board doesn't typically like to give this variance. I'm asking for a little bit of leniency so that I don't have to get a crane truck in there to put a new tank in or another machine to install something. I'm already offered to the homeowner to come out every March or April and every September, November to clean the filter and determine whether the tank needs to be pumped. I'm sure that'll be much more adequate protection than just installing a 2-compartment tank with no maintenance. I do that already for 100 filters a year, so I have no problem doing that for her twice a year for as long as it takes. And I'm happy to answer any questions the board might have.
Okay, Darren, thank you. Yeah, I've been, as you know, Darren, involved in this, in the loop on it. Again, it's unfortunate. I mean, it's clearly, this plan was signed by me. This is when Kevin had left and we were without an agent. And the plan clearly says 2 compartments. So the installer should have picked up on it. But again, I know there was some text back and forth and there was a misunderstanding on it. The 2 compartment tank is only a local Lakeville regulation. It is not Title V. Very few towns do have the 2 compartment tank. Lakeville's only one of the very few that require it. But again, as you're right, Dan, we don't like to not allow, you know, when on repair, we like to have the 2 compartment put in.
Yep, I understand.
That being said, again, with the location and everything of this property, after the fact, to try to put a tank in now is not the time to do it, I guess, in my opinion. However, the mishap happened. The only other thing I would maybe, in our regs, it does say if you leave, you need to just certify the tank and writing to us that it's structurally sound and not leaking.
Yep.
That would be a requirement I think I'd want, and maybe consider going to a bigger commercial filter on it.
I can do that also. Yep.
Residential, go to like the 525 filter that's much larger.
Yeah, I know which one you're talking about.
That's the only 2 comments maybe I have at this point on this one. Bob Palucci, I'll turn it over to you.
Yeah, Darren, do you have any idea how old it is?
I was put in 2004, so it's 16 years old. It's not leaking. The Title V showed it was fine. When I went there, it was completely full. I then did see it when it was pumped when I was just there the other day because he just put the system in, so it wasn't full yet. There doesn't seem to be any cracks or anything, but I would definitely have no problem putting on a bigger outlet riser because there's only a small one on there, and then putting in a bigger filter if that's what the board wishes.
Well, yeah, that was my question. So it's under the 20, so the only issue with it would be that it's not 2 compartment tank, and that,
Correct.
you know, I know there was some confusion there, but I mean, I wish the installer had called in too, though, because, you know, I think, I mean, I'm an installer, Derek's an installer. I mean, you just don't call, you know, if you have a stamped plan and you give a bid on it, you know, you don't, you know, until the Board of Health approves it, you know, the engineer can't make changes unilaterally, whether it was by mistake or not. So, I mean, as much as it all happened, I'm a little concerned. I mean, I don't know who it is. I was hoping that they were going to be called in tonight, but, you know, I have a big concern about that, you know, that whoever did it doesn't even understand Title V and they just can't make a change without the Board of Health approving a change on a plan. I mean, that's, you know, so, but with that being said, I mean, if it was in any other town, it's under 20 years old and it would be, you know, and it's under 20 years old and it's 1,500. So, yeah, I think it's kind of excessive to, you know, to have the homeowners, you know, pay for this or however it had to get paid at the end of the day to change this. And like you said, if you put a bigger filter on and you put that riser on, so it's more access to it, and then you're going to take the extra step to certify it, I'd be okay with it.
Okay, thank you, Bob. Chris Pratt, comments, questions?
No, I don't have anything to add to what's already been said. So I'm in agreement with the extra filter and the certification from Darren. And, you know, I don't know, do we send a letter to the contractor just to like, hey, as a reminder, or, I mean, or does he already know? Hey, I should need to look at this stuff.
Yeah, I talked to him several times about it. You know,
And,
so
yeah,
anything with him in the future, nothing is he likes to try to get a verbal approval. But anything with him, it has to be in writing from now on. That's just how it's going to be with him. Just
Okay.
because he makes a lot of claims about a verbal approval that never happened.
Yeah, I mean, because we don't have to give him a license next year. So I mean, if, he either plays by the rules or he doesn't, because to me, this is a big one. I mean, you pick up a plan, you give a person a price, and then you say, oh, because somebody else said I didn't have to do it, I didn't price it, now you're trying to stick it to the homeowner. I mean, I'm not happy about the whole scenario myself, but there's really gonna be no damage to the homeowner at this point if we don't make him change the tank. And, going out there every year and inspecting it is more than any other tank that's done in town. And so I'm fine with it.
Was it priced accordingly too?
You'd have to ask the homeowner. He said he did not include the tank because of my text that I sent him. I
Okay.
would tend to believe that. But the homeowner is on the line if you wanted to ask her.
No, she doesn't need to get involved. I think it's.
Yeah, I think it's all settled and it was just a little head war there.
So,
Okay, thank you. Ed, any other comments on this one?
No, like I said, I don't have any issue with it either. I mean, it's it's not a health issue, I don't believe, especially if Darren's gonna be doing that with the extra filter. I think it would shorten the life of the field and just want to make the homeowner aware of that. But I don't see any health risk. Most of those houses in that area are hooked up to the municipal water there, so it's not, there's no wells within 100. I think the closest well is 180 feet. You get good separation of groundwater. So again, there's no health risk, so I don't have any objections to granting the variance.
Okay, thank you, Ed. Is there anyone on Facebook that would comment on this one out there?
No comments from Facebook.
Okay, thank you. I know the homeowner was online. I'll just make sure that they don't want to say anything before we make a vote.
No, I'm good, thank you.
Okay, thank you. Okay, I'm fine with the two. If somebody would like to make a motion.
Yeah. I'll make a motion. We approve the after the fact variance for the septic repair at 13 Summit Street in Lakeville. With the caveat that Darren's going to put an extra, a better filter on, and he's going to certify the tank and everything. And I think he said 2 annual inspections too, Darren, right?
Yes, every April and every end of September, November, I go out. Am I on there? Where am I?
Okay, thank you. Do I have a
and a
second?
bigger riser, right?
Yeah, I'll do the filter, the riser, and the twice a year inspection for it. That's not a problem.
I'll second that with that in there.
Any discussion? All those in favor, Bob Palucci,
Aye.
Chris Pratt,
Aye.
Derek Maxim, aye. Thank you, Darren.
Thank you, guys. Have a great night.
Thanks,
Sure.
Darren. Thanks, Cheryl.
Thanks, Cheryl. Next on the agenda, 4 Old Powder House Road, continue discussion from November 4th, 2020 meeting with Zenith Consulting Engineers to discuss requested variances. This one has continued for quite a while now. So I'll turn it over to Jamie just for an update to see where we stand and then do comments and questions from there.
All right. Good evening, everybody. Jamie Bissonette from Zenith Consulting Engineers, for the record. I wanted to start off by saying that we had hoped to have all of the material to present to the board tonight, and we don't. And so I'm going to kind of bring everybody up to speed as to where we are. So as you know, our last meeting, I believe Council and Ed had made reference to a DEP email or letter with some guidance information that we emailed DEP back for some clarification. We have sent that clarification email to the board, to the Board of Health. I believe Ed has passed that around. And what that states is that as long as we meet the environmental level of protection and prove that it would be manifestly unjust to deny the variance, then the board, if they grant the variances, which they can, then we're allowed to then use the advanced treatment if we want. Understanding that, we have to prove that we're meeting the environmental level of protection. My office alone it doesn't handle some of the testing that's allowed for that. So what we've done is we've subcontracted out a hydrogeological engineering company who is actually doing some testing and modeling for us on that process itself, so that we can provide real scientific data and testing that will hopefully back up our position. But we're still waiting for the report. We were told we'd have it tonight and we just don't. So at the end, we're going to ask for a continuance if we can, and we should have that. It's been made clear to me that we'll have it in time for the meeting, prior to the meeting, which we'll get to you ahead of the meeting, that report. All of that being said, that's where we are right now. So I'm happy to talk about it or answer any questions if anybody has any, but wanted to pop in because we were hoping that tonight we'd have the report and be able to discuss the project at large, but I think we're gonna have to wait another few weeks to be able to do so.
Okay, thank you for that, Jamie. A couple of questions, I guess.
Yes, sir.
On emails from DEP, are there any other emails that were going back and forth? Ed was looking to see all emails that you had with DEP. It looked like you only sent the end one.
That was the only one that we received. I can send you the email that was sent. The email that I sent, we actually had, several questions, and we're happy to share it with you. But it's basically exactly like what we've talked about, just asking for clarification on who has the ability to grant variances. DEP has told us in face-to-face meetings that the Board of Health has that ability. And so we were looking to just confirm some things that we've been told. And then we had questions as to whether or not the board has the right to grant variance to use the advanced treatment in a situation like this. And I think that's kind of where the email reply from DEP came from, was saying that, yes, the Board of Health has the power if they decide they're going to grant the variances, and understanding the provision in which you have to use to grant a variance. So yeah, I can absolutely send that to Ed. We're absolutely not looking to hide anything. We're pretty much an open, an open door. We'll send you those emails, but I've only received one response that I can recall, and that's the one that I sent to Ed. I do know it was highlighted. That's exactly the way we received it from DEP. That wasn't edited by us. You got it. Just what we did was I put it in a PDF and sent it over. So, but I will get you the email chains that we have. That's perfectly fine.
Okay, thank you. And another question, is we would, town council would like to try to get all information on this 10 days prior to the next meeting if we continue it, so he can have time to review this prior. Would that be acceptable to get it to our office so he can review what they're trying to propose and have time to write an opinion on it?
I don't see a problem with that. When's the next meeting date? Because what I'll do is, if it is the beginning of December, I think that'll provide our hydro geoengineer enough time to formulate his report, get it to us so we can send to you.
Well, it would be on the 2nd, which is in 2 weeks. So 10 days before that would be next week, which is Thanksgiving. So I don't know if he'd have to get it to you in the next few days to make 10 days.
So then we would be looking at the 16th
18th,
possibly.
16th.
Murray, are you okay with a continuance to the 16th, sir?
Yeah, I'm fine.
I would say for safety reasons that we should do the 16th then, as long as Mr. Wachenheim is okay with that and the board is.
I'm okay with it.
All right, yeah, I would be okay with it. And again, keep continuing these, Jamie. We're kind of getting to the end of keep continuing. We'd like to resolve it. I know with the coronavirus, a timetable that starts again on December 1st, even though we've been going to these meetings.
Yep.
But we'd like to try to get a decision or just denied as an incomplete application until you get everything you need instead of keep
Understood.
going
Yeah.
to every meeting.
I think that this is the last piece. I really do. I think that this is going to be the last piece, but if we see this dragging out any longer, we might ask for a withdrawal without prejudice. I'll talk to my client, understanding the board's position, but I think that for the 16th, we should have all of our ducks in a row and have enough time to get this to council 10 days prior to the hearing.
Okay. And one other question, because this is kind of new to me also, all this, what you're trying to do it as. So if you prove to the board that this system, a conventional system, meets the criteria,
Yep.
you can approve any treatment system after the fact, after that, just to put in there? Is that?
So, and you'll see as part of our email to DEP, what we said was, and I'm going to paraphrase because I just don't have a photographic memory, but it was something along the lines of, if the Board of Health agrees and finds that, gives us the variances and we have a permit to install, if we decide that we want to voluntarily add advanced treatment on, which is the case here, if we do receive our variance, we will still install the advanced treatment. Then is that an allowable thing? Because I think councils, and I don't want to put words in council's mouth, but my understanding was council said, even if we got the variance, we still couldn't put it in because it says it has to be in full compliance with Title V. DEP's email back to us said, yes, if you get the variances, yes, you can. Our intention would still be to put in the advanced treatment if we do receive the variances, which I know have not been voted on, but that would be the intention.
Okay. All right, yeah, because you'd have to prove to us those two criteria, which we've already gone through at the previous meetings, manifest and
Correct.
chest.
Yep.
And the groundwater issue.
Correct. Yep. And so the treatment is where the hydrogeo comes into play. And again, I have not seen the report, so but when we have it, we'll forward the results.
Okay. And then also on that treatment system, you did propose, I mean, I know you had somebody come in at the previous meetings and telling us how it meets all the criteria and everything. But I'm also not a big fan of that type of treatment system where the blower can be shut off and it can be used by gravity without the system in proper working. I'm just not and with this system, you can't get higher above the water table to like a 5-foot separation. You're trying to do gravity. On
Sure.
other treatments, if it's already the pump and pressure dowsing, you get to 5 feet. So
I'm not. I don't think that we're opposed.
We get to.
Yeah. Yeah, we're not opposed to other treatment systems. My personal favorite for design purposes is the Aramco AX20. I think that they're a fantastic system, and that definitely needs pumps to function. So if the board grants the variances, I am very open to changing the advanced treatment to something that I would require a pump, and the treatment to actually work for it to function. I understand that that comment, and we're open to it.
Okay. But again, that's after it's just if we could, do we have that email to put up on screen just in case anybody's watching and wants to see the email?
Absolutely.
To get every, I mean, it says it is very hard to meet the criteria. So,
Oh yeah, no, it absolutely, and it is. It's not an easy. I'm going to actually just open up the email directly and put that on the screen. Can you see this?
Yes.
All right. So as you can see, I had sent Brett an email It appears on November, no, sorry, let's see. Here, October 8th, yes. All right, so on November 2nd, I sent Brett an email that you see here. And then he responded on November 4th. And this is what it said was the Microfast approval states the system is approved for facilities where the design flow is less than 10,000 gallons a day and where a conventional system with reserve area exists or can be built on site in full compliance with the new construction requirements of 310 CMR 15000 and has been approved by the local approving authority. And then it references, it says, in a previous email from Boston, it stated, because the site in question is new construction, it has to satisfy all the criteria laid in 310 CMR 15410 to seek variance. This includes both, one, demonstrating the level of environmental protection that is at least equal to that provided under 310 CMR 15000 can be achieved without strict application of the provision of 310 CMR 15000 from which a variance is sought, and two, demonstrating depravity of the applicant of substantially all beneficial use of the subject property in order to be manifestly unjust. Under the current circumstances, it will be difficult to satisfy both the criteria, especially as it is new construction. If the Board of Health approves the variances, then yes, they could move forward with their plan to install. Our point was that the variance standard for new construction is extremely hard to meet and is not likely that they would have granted such a variance. I agree with that entire email.
Okay, and so now you've hired somebody to prove that point that.
Well, we've hired somebody not to prove it. We've hired somebody to objectively give us an answer as to whether we're meeting the environmental level of protection. And that's the question. It's not something that I do as far as engineering. There are different facets of engineering, structural, traffic, and transportation. This person does hydrogeological testing, wastewater treatment plants. They have the right software modeling and expertise to do such. And not only will they prepare a report, but we'll actually have them for the meeting. So, you know, the board can ask them questions if the results come back favorable. If they don't, then we probably will not have them on the meeting because, you know, it's going to be a little bit of a different angle for us to look at.
So Jamie, is this to show that a conventional system could go in there?
Yes, it's not, and it's, Chris, you're absolutely right. What this does is this is looking at it and saying, will the level of treatment, if a conventional system went there, equal the minimum requirements of Title V?
Well, so then you'd meet setback. Well, yeah.
Exactly. It's not necessarily a simple question. It's more of an environmental question of treatment. Yeah, some treatments are needed for, you know, vertical separation deals with a lot of treatments. Some of them require horizontal. Not necessarily my area of expertise when the chemistry breaks down, Chris. Yeah. And so we've reached out to the people that they are, and it's the testing is ongoing.
Okay.
Any other questions, Chris?
No, I'm good.
Bob Lucci, I'll turn it to you.
Yeah, no, I mean, let's see what he says, but we definitely got to have it in time because I definitely want town council to review any of it because, you know, this is all turning out to be engineering and legal jargon. And, you know, from a guy that digs dirt and hammers nails, I mean, we're getting a little too technical for, you know, I want to be able to get some straight answers from town council before we make the decision. And I want them to have plenty of time. And if that engineer is going to be on that night, I want to make sure that, you know, we can have him call in also. So,
yep.
So it'd be important to get it, like you said, those 10 days. Because, and then the following week, you know, a week or so later is Christmas. So,
yep.
and the continuances don't bother me that much because you could just reapply next month and just have to pay the fee again. So, I mean, I know it's dragging and it's getting old. So, I mean, I know people want to get it to move on and stuff, but I mean, you know, you're getting that put together, we're gonna want that time to have our attorney review it, because
Sure.
I don't know if we've even sent that letter to town council. I haven't talked to anybody about this yet, but I don't even know if they gave us an opinion about that letter. And I'm wondering if, you know, what if that's happened or not, and if not, they need to, that might be why he's waiting for that other stuff to come in maybe, but.
Okay, well, yeah, we'll provide
yeah.
whatever information we need to, so that council has everything from us prior to.
So, yeah, so I don't mind continuing it until the, what do we say, the 16th?
Yes, sir.
16th, correct.
Yep.
All right, thank you, Bob. Ed, Colin, any comments or anything on this one to Jamie that you'd like answered prior to the next meeting, or information that we would need?
No, just as you had mentioned, if we can get all the correspondence with DEP, that would be helpful. And what you said earlier about getting it at least 10 days prior, that would also be helpful. So as long as we get those two criteria met, I'm okay.
Not a problem, guys.
Okay.
Yeah, because Jamie, if I can just say, Derek, yeah, when that letter came through, I didn't read it as it was a good letter at all. So, I mean, I actually thought Ed highlighted the yellow stuff. And then when he told me it got sent that way, I was kind of like, then I must be missing something, because, on those parts of it. So, now that you kind of explained that a little bit tonight, I guess we can, we'll look at it again in a month and see what we can do.
Okay, no, I appreciate the patience, and it appears to me you guys are really thinking this through, and that's all we can ask. We present the facts and the boards make the decision. So thank you for your patience, and hopefully we can get this wrapped up on the 16th, and we'll get you everything in time so council has time to review it.
Okay, thank you, Jamie. Is there anyone on Facebook that had any comments on this one?
No comment from Facebook.
Okay. Mr. Murray, any comments prior to
Well, I
continuing?
appreciate your indulgence. I mean, I've waited 40 years now, so another few weeks isn't going to matter. I'm glad that you got the patience to collect the information that we're going to present, and I'm optimistic it will be positive. But as Jamie said, we're waiting for the report. But we'll see. We'll see when we get it. But in the meantime, I just want to say, Derek, Bob, Chris, happy Thanksgiving. And Jamie, thanks again. And happy Thanksgiving. I'll call you.
Same to you, Murray.
Thank you,
Yep, same
guys.
to you.
Thanks. Have a good night, everybody.
All right, with that, I'll make a motion. We continue this until our meeting on December 16th.
Second.
Any discussion? All those in favor, Bob Palucci,
Aye.
Chris Pratt,
Aye.
Eric Maxim, aye. Thank you. Thank you,
Thanks,
guys.
guys.
Thank you, Jamie. Murray.
Thank you.
Thanks, Jamie. Thanks,
Be
Mike.
well.
Okay, next on the agenda, betterment loan. Approval of betterment loan for 54 Montgomery Street in the amount of $60,074. I'll turn it over to Ed. Any comment on this one? Was this one all set to approve?
Yeah, it's all set. Like I said, it is a large system. It's also a fast system, so that's why the cost is so high. But everything else is in order.
Okay, thank you. And do I have the original that needs to be signed and brought back? Was that in that packet tonight?
I'm not sure on that.
Okay. All right. I do have a copy of it here, so I'll just find out in the morning from Fran or Lori. I have no other comments on this one. If someone would like to make a motion.
Yeah, I'll make a motion. We approve the betterment for 54 Montgomery Street in the total of $60,000, $60,074.00.
Okay, I'll second that.
Any discussion?
Yeah,
All those
just
in-
like to say one thing, and I say this every time, I'm like a broke record, but for anybody watching that doesn't understand, these are loans. We get money from the state. It's a fund that we have that's available to everybody out there. If you don't need good credit, you just got to be a homeowner in need of a new septic system. The town lends this money out. it's a lien on the property. We get paid back first before anybody else. It's a super lien. So the town's never lost a penny with this program, and we actually charge a little bit for processing and interest. So it's a win for the people that if they need a septic and they have no other way to put a new septic system in, this allows you to get it in, and it goes in your taxes. And so it helps a lot of people. It gets a lot of clean septic systems put in the town. And when we're voting on these, we're not giving away $60,000. We're just lending it in a way that the town always gets it back first. So with that, I'm good.
Okay, and we had a second on that. So all in favor? Bob Palucci,
Aye.
Chris Spratt,
Aye.
Derek Maxim, aye. Okay, thank you. We're going to jump down onto old business. Just a quick 43D committee update. I know we have, you have the meeting tonight, Chris, so I think we're getting
14
short on
minutes.
time. So
So update is let's get moving.
brief as you want. Is there any other discussion on the 43D from you, Chris?
No, the memo, I mean, I think we talked about it. It's just tonight, where the 15 days is up, I think Friday. So we needed to let them know that everything's complete. So then once that's set and we vote on it, then the 180 days for all the hearings and all the other stuff starts to roll. So I think December, that first week of December, we'll all be meeting with that big joint first meeting, big public hearing for the introductory and stuff like that. So other than that, that's it.
Okay, thank you for that. Any questions to Chris from you, Bob Palucci, on the 43D?
So Chris, have you had a chance to talk to that review engineer that the town's hiring on our behalf? Have you let him know any of the stuff we've talked about, or is that meeting in December when we bring that all up?
No, I had not specifically brought up our stuff. I think we may be meeting, what, tonight he'll be there. I'll bring that up tonight.
Okay.
I'm pretty sure he's going to be there. So if not, I will reach out this week to get some specific stuff from him too. So we're ready going into that first public hearing.
Okay.
All right, thank you, Bob. Ed, any questions for Chris on that 43D committee?
No,
Okay, thank you. All right, that is it for that then, Chris. Any pending Board of Health items? I don't have any. Bob, anything for the board to discuss?
No, I'm assuming Ed's gonna get to COVID, so I'm good.
Okay, yes, that's right after this. Chris, anything? Pending
No,
items? Okay. Ed, if you have any pending items for the board to discuss, if not, I'll turn it over to you for the announcements for the COVID-19 update.
okay, yeah, so I have no pending items. So for the update, number of cases in Lakeville is still increasing. We had 18 in the last 2 weeks. So it's not a fluke or anything. It's continuing increasing, and it's not just Lakeville, it's everywhere. All the towns around us, Freetown, Dayton, they're all going up and they're all increasing. We are no longer in the red, but that is not because we lowered our cases. They changed their criteria. The state decided to change their criteria because so many of the small towns were in the red that they came out with a new formula. So now we are still considered to be yellow. So I guess that's good news, but like I said, it's not because we decreased the cases. So I just want to make that clear. The number of cases is still going up, and we really need to do something to slow that down. And this is a difficult time, both the cold weather and the gatherings. The recommendation is to try to keep your Thanksgivings to 5 people, but definitely under 10. Obviously, some people have more children than others, but also try to avoid mixing generations where you have the grandparents and the kids come. That's a very risky situation. So they're advising against that, and try to find other ways to meet, or whether it's just calling or Zoom, doing FaceTime or something like that with some of the kids, but a lot of kids are coming home from college right now. And, a lot of grandparents want to see those kids, and it's just a bad, like I said, it's just a high risk situation. Just in September, I think we had in Massachusetts, there are 20 people on the ventilators. Now we have over 70 people on. It's just increased that much just in 2 months' time. And like I said, once you get on a ventilator, things are not looking good. So even the number of deaths increased quite a bit today as well. So everything is going in the wrong direction, and we really just need to think about our gatherings, whether it's a holiday gathering or a weekend gathering or anything. We just really need to think about that. And like I said, the vaccine information coming out is very good, but most people will not get a vaccine until April or May. So it does not mean we can act irresponsibly for the next month or two, because these next 2 months are going to be the most critical times, and we really have to just change our behavior. That's all.
Okay, thank you for that update. I'll turn it over to Bob Palucci. Any comments or anything on the COVID?
No, I mean, Baker was on today and I caught some of it. And, a lot of the states have already started shutting down things more. I wouldn't be surprised if our states, gets there sooner than later. A lot of states are stopping the kids from going back to school, which I think is a shame. But I mean, it's not just the kids. So I wouldn't be surprised if that happened again. I wouldn't be surprised if the college kids, in Boston, they said, if you go home for Thanksgiving, don't come back for the rest of the year, which was kind of shocking to me to see the guy say that. But, if you watch the news national, I mean, there's hospitals are full now the first time. I mean, they're opening up they have those refrigerator tractor trailers down in Texas. They got 3 of them full with 2 more coming in. They can't even bury the poor people fast enough. And it's a serious thing. We're having more cases and we're having more deaths. Well, the deaths aren't as high as they were a few months ago, but the hospitalizations are right up there again now. And it's just a scary time. I mean, it's been a long drag for everybody. Luckily, last year, this didn't start till after the holidays, and we got through them. Everybody's sick and tired of it. Nobody's more sick and tired of all this than I am. But if we could just be safe and get a few more months under us, hopefully we can make up for it next year and have something to celebrate about by the next holidays.
Thank you, Bob. Chris, any comments on it?
Yeah, there's not much to add to that besides today the FDA did give emergency authorization to a company to push more rapid tests out. So hopefully that's one more tool in the toolbox to help, find the cases and get people to quarantine before they spread it even further. That will help cut down on the outbreaks before, the vaccine arrives. Because the vaccine's going to go, 2 or 3 different companies, about 20 million dosages each. The first rollout is going to go to first responders, frontline workers, health care workers, and the elderly first, probably, or high risk people, I should say. So yeah, we won't get anything until probably the early spring or after that. So that extra testing, I think, could help get us to hopefully start to keep the numbers to flatten out, so that we don't have to close stuff down too. Hopefully there's more testing like that on the horizon soon too. It would be nice if there was more funding to push more testing out there too, but we'll see. Other than that, I'm good.
All right, thank you, Chris. Okay, we're going to go down to review and approve meeting minutes as typed for September 16th, 2020. All 3 members were present at that meeting. I have no problems with them. Bob Palucci, any comments on the meeting minutes?
No, I'm okay with them.
Chris Spratt, comments on the meeting minutes?
No, I'm good.
Would you like to make a motion on that one?
I'll make a motion to approve the meeting minutes dated September 16th, 2020 as typed.
I'll second that.
Any discussion? All those in favor, Bob Palucci,
Aye.
Chris Spratt,
Aye.
Eric Maxim, aye. Okay, thank you for that. All right, next on the Agenda is to review and approve meeting minutes as typed for
That
October
can't be
20.
now, Derek.
Yeah,
the-
I'll make a motion to go into executive session.
Guys, I didn't get a chance to read through it all on those, and I knew we were gonna have to take extra time to go in. Do we mind continuing it to the next meeting?
Nope, that's
I have no
fine.
problem with that. Make a motion.
Make a motion, we continue the executive session meeting minutes approval till the next meeting on December 2nd.
I'll second that.
Any discussion? All those in favor, Bob Palucci,
Aye.
Chris Spratt,
Aye.
Eric Maxim, aye. All right, thank you for that. That is it on the meeting. I have no other comments.